So this afternoon, I'm going to be presenting on the research that we've undertaken for early intervention targeting impulsivity and the behavior of adolescents. We're talking about many different intervention strategies that can be undertaken when it comes to public health. And 4 interventions that deal with alcohol abuse or drug abuse. Most of the intervention that is being offered the interventions are offered when the person has a lot of difficulties with drug abuse and alcohol, but a lot of research demonstrates that the majority of the population do not receive the primary care that they need, and that even among that small portion of individuals, those who do receive the services have often lived through 10 years of suffering associated with their consumption abuse before they get any kind of treatment or help. And this is the statistics. These are the stats that have led to our investigation and research. We are looking at interventions that can be offered to a larger portion of the population and earlier, with earlier intervention to reduce this suffering related to excessive consumption and abuse of drugs and alcohol. So there's a lot about brief intervention and brief motivational intervention because there you can have a better impact on alcohol consumption. Is very efficient also to reduce the abuse of drugs, and it allows for a lot of harm reduction. There's also the universal approach. You see this in primary schools and secondary schools, high schools, where people in public health, or people in the school are trying to promote general coping mechanisms to help youth become more resilient so that we can delay any drug consumption and alcohol consumption. And with many of these reviews, we now see that the impact of this intervention is very little. The success rate is very, very low. So the intervention offered in schools is often not evidence-based. And those who are assessed or are evidence-based, very few are actually evaluated in any rigorous fashion. And therefore, you can't come to any conclusions. Amongst those that were actually properly evaluated, you see that the impact is very low. So you have to, if you offer, for example, an intervention to the whole high school, you might have an impact on one person. And this is the kind of result that has led us to look into selective intervention. Selective intervention targets specific people or specific youth who present a risk factor. So it's a preventive measure. In other words, you are offering an intervention before the individual starts to have any kind of problems of drug or alcohol abuse. And this kind of intervention is the one that we have developed as a solution for drug and substance abuse. And the strategy involves personality intervention. We look at the range of risk, the dimensions and risks that have to do with the temperament of the person and the character of the person and the behavior of the person. So we're going to talk about 4 profiles which are associated with early excessive abuse and consumption of drugs and alcohol. And this, of course, leads on to abuse in adults as well. In many studies, we look at use of methadone in clinics in Nova Scotia and in Montreal. Amongst the people who are receiving methadone replacement, if they have one of these 4 personality profiles which make them high risk, we see that they are likely to abuse other drugs, and therefore that their treatment will not be successful. So these 4 profiles involve this drug and medication and alcohol abuse at all levels, and particularly an early consumption and an early addiction. So why are we looking at the personality when it comes to drug abuse? Because these personality profiles create dependence in drugs and alcohol, and they also they make these people at risk for other psychopathologies. And in fact, one of the reviews published on this subject, actually many reviews have been published on this, many articles, and there's quite a wide literature that looks at the profiles of high-risk people leading to addiction. But this is a longitudinal study in New Zealand, and they did an assessment with children who were 3 years old, and they classified this cohort into minors, the disinhibited, externalized people, disinhibited, and those who are inhibited. And they demonstrated that after a follow-up of 18 to 19 years, at 21, the youth who were extreme, either very disinhibited or very inhibited, were also at high risk for addiction and abuse for alcohol, but also at high risk for different forms of psychopathologies related to their addiction. And so you can see that the behaviors, aggressive behaviors, violence, was related to under-controlled or disinhibited, uninhibited, under-controlled personalities. And you see here that youth who were inhibited or over-controlled were more at risk for a depression, anxiety also. They were at high risk for anxiety as well. So this is the literature that exists, and you can link, therefore, these personality profiles with behavior patterns, and it tells us a lot about the comorbidity that will develop later in life. Let me go back now to this slide again to tell you that these personality profiles or temperament profiles, when you measure them in very young children, inform us about comorbidity, but also about the choice of drugs. For example, an adult who is at high risk for anxiety will make a certain particular choice of drugs, and it's associated, therefore, with a specific high risk towards drugs that have to do with anxiety. And others may, for example, have an addiction to opiates. So the vulnerability is different. They're at risk for different kinds of drugs as well, such as cocaine, for example. You can tell from the profile analysis that's done when they were very young. It's very difficult for me to explain the whole of this research because we don't have time, but in many studies we have demonstrated that these profiles are related also to different learning styles and different ways of reacting. So a person, for example, who is at risk for anxiety, when they consume alcohol, well, alcohol acts more as a negative reinforcing agent. It's also a very strong agent. The word in English is that it goes from a sedative to anxio. And so this person who doesn't have this level of anxiety in their personality will not have the same reaction to the alcohol. So your personality will put you at risk for certain substances and not others. We have therefore demonstrated that when people are looking for strong sensations, if we use neuroimagery methods or even subjective methods in physiology, we can demonstrate that people who are looking for strong sensations are very sensitive to the stimulating impact of alcohol and drug abuse. And it is these people who become highly stimulated when they consume. And we can explain why they consume for those particular reasons. Now, to better understand these different profiles, personality profiles, we wanted to experiment with an interactive exercise with the participants here. So we've got a scale that was developed so that it would be relevant for a clinical or school environment for different ages. So it's valid for people who are 12 years old until they're adults or any age. And this scale has been translated into many languages, and in particular for the population here in Quebec as well. And maybe you can see that on your laptops you can also complete the questionnaire. Is there a questionnaire? Yes, you have to complete the questionnaire so that you can understand the subjective aspect, so that you can understand if that is something that is feasible in your practice or in your school. Then you can see that none of the questions actually deal with your level of consumption at all, or abuse. Nothing deals with problems in life, but the questions are actually about the personality traits. So they're asking general questions about your style. Maybe I'll give you 2 minutes so that you can complete this questionnaire, and then we can do an evaluation of the personality of the participants in this room, perhaps. A question that's not audible to the interpreter, I believe. Somebody's asking something. Perhaps it will also help you to understand how we measure these personality profiles, what kind of questions allow us to measure that personality profile. Oh, there you are already. Perfect. So we can see here that there is a huge participation in this room. Thank you very much indeed for your participation. I'm going to give you a few more minutes so that you can complete this questionnaire. And then Christine is going to very quickly undertake an analysis of these data And then we'll go back and give you some feedback. And then you'll understand what kind of youth or student would qualify for the kind of interventions we have developed, and how we target these personality traits through this scale called SERPs. So I'll get back to you with your results, but just to continue my presentation, you can see that we have standards that were established with cohorts of thousands of youth and adults. And you can see that standards here for the adolescents who are 15. We can give you also standards for adolescents who are 12 years old, university students here, averages and standards. And here, I don't know, we can't see it, but we also have actually demonstrated that the strategy we're using to select the youth who qualify for this kind of selective intervention. And you can't see it here. I don't know why. Normally you can see it in black. I'm not sure why it's not on this chart, but we are using an actuarial approach, and that means that we select the youth with a standard deviation that is a little above the norm and the standard. So with a standard deviation that is as close as possible. So they're at risk compared to the average population. So what do we do with our interventions then? Well, the intervention is based on a theoretical model that involves personality traits here that you can see here. And there is a neurocognitive and motivational aspect to it. So very quickly, that we're looking at an information processing style where the individual has difficulty in a part of their brain that does not allow them to do this kind of information processing and creates a certain behavior. And this style leads to a certain personality and demonstrates, therefore, that a very easy task, such as a task that says, okay, if you see this dot on a screen, press on this dot, and if you see something or other, then stop pushing the button. Well, this is related to impulsivity, and it can actually predict substance abuse in the future. So what do we do with these people who demonstrate that they are at risk through this personality scale? We have incorporated all the practices already with this evidence-based model. So we're looking at evidence-based practices such as motivational ones, behavioral ones, and we have integrated with all this information on the learning style of these different personalities. So you are doing a very brief intervention, but it's targeted to the different cognitive styles and specific cognitive aspects of each personality and learning styles. And because it's very specific, it allows you to make that intervention very brief but successful. So you can do it in a clinic on a face-to-face, or you can also offer it in a school environment to a group of students. And when it's offered to a group of students, the students experience something that is very strong and very successful. But you can also use this intervention in a home. For example, a mother who has an anxiety problem and an anxiety deficit, you can even intervene on the phone with the mother, for example, in a home. if she can't make it to the clinic. So there are many different ways in which you can actually intervene. And we have done a randomized study of the impact of this targeted short intervention on the behavior of the cohorts in terms of drug abuse. And this is the booklet on impulsivity that is offered. There is a self-evaluation and assessment. There are a number of scenarios that have been developed as well for the youth. These are real scenarios that demonstrate how the impulsivity of a youth is going to influence their behavior. And as I said, there were a number of randomized trials that demonstrated here's one, for example, one of the studies that we did. Let me just show here the number of people that were involved in this preventive randomized trial. And that is why it's so hard to create an evidence-based result, because you're trying to prevent an issue, then you have to intervene, but you also have to do follow-up and testing with a lot of people, and you have to do a screening, and we came up with 45% of the population that was demonstrating that they were above this profile. And in many, many countries, we have demonstrated that in the school environment, we were able to offer an intervention of 2 sessions to youth in the same year who demonstrated one of these 4 profiles, personality profiles. And if you do a follow-up thereafter for 2 years, you can demonstrate that they are now less at risk than they would have been otherwise prior to the intervention. And this is here, the follow-up. They are less at risk to abuse cannabis, and 81% less at risk of consuming cocaine and abusing cocaine. That says, gee, Tommy, I'd be lost without your constant peer pressure. So what happens with the rest of the youth population and the peer pressure? We're demonstrating here that the intervention on this 45% of the population who demonstrated they were at high risk also has an impact on the rest of the population as well, on the consumption patterns, therefore, of their peers. And so there is a herd effect. The whole population is now immune. Very quickly, let me also mention that often I'm being criticized and I'm being told that a brief intervention of 2 sessions might be able to help people who are at low risk, but those who are at very high risk need a lot more intervention, and that this kind of intervention is not relevant. And we have demonstrated here that the intervention was in fact more successful for people at high risk than low risk. With people, for example, who had ADHD and other problems and were very high risk, they definitely demonstrated that this intervention was successful. This was behavior problems, for example. There was also ADHD and so on, and we've demonstrated that we are one of the few people throughout the world who have demonstrated that you can actually prevent mental health problems with youth by using this very brief intervention but highly targeted one. And we've had an impact on depression. We have reduced also people who were already depressed by 25%. We've reduced anxiety and also behavior problems. So people, the youth actually love this approach, and we ask the youth to tell us, to give us feedback, give us a positive and a negative feedback. They love the format of the intervention. What do they not like? What have you learned? So this cognitive approach, this metacognitive approach, has allowed them to be a critical they were able to self-criticize their own thoughts, and that was very important for them. What changes were they considering? There is a real support for this psychological and cognitive approach amongst the high-risk youth.
So very quickly on the conclusions, we see that this cognitive approach integrated into the school setting or other settings, other clinical settings, is very effective for young people to prevent problems during their youth. There's benefits in terms of their symptoms. Here we are with the conclusions here in French. So there's benefits in terms of excessive use problems related to alcohol and related to peers using drugs and victimization acts of aggression. We've recently shown that all of the school has reported that there's been less victimization in the schools where they've offered this program. And then this effect can be explained by the impact of the impulsive young people. They say that they're less likely to commit aggressive acts amongst their peers. And then it's also an effect on symptoms of mental health amongst young people. And we've shown amongst those who were starting to take drugs, we can see that they changed the reasons why, for example, they were taking alcohol. They've said there's less interested in taking alcohol to try and manage their emotional and behavioral problems. And so it's amongst these effects that they've actually been able to reduce their consumption. I'd like to finish off by thanking